Hi guys, this is Cressida here. I'm the General Manager of AIMA and I'd like to welcome you all to this webinar, the second of our COVID-19 webinars. I just wanted to say that the reason for doing these was to really build a sense of community within the integrative medicine community. We want to encourage a collegiate exchange of ideas and information, and we're hoping that this can do this. We're always looking for topics that we could cover. So if you have a topic, please just email me at admin@aima.net.au. I'd like to let you know about next week's webinar, which will be the same time, same place, and it's going to be Dr. Robin Kelly talking about mast cell activation 5G in the world of coronavirus. And then the subsequent week, which is, I think, the 19th, is going to be Patria King, and she's going to be taking us through some issues of how to deal with stress and grief and isolation. So just a few little housekeeping things. At the bottom of your screen, you'll see there's a Q&A tab. If you've got any questions for Leila, if you could just put them in there, and then after she's done her presentation, she will address your questions. There will also be the chat going on the side, and we're really privileged to have Dr. Sandeep Gupta joining us there. So if you've got questions, hopefully Sandeep will be able to help answer them there in the chat as well. So now I'd like to introduce Leila to you. Dr. Leila Masson, she is an AIMA board member. She's an integrative paediatrician, an all-round beautiful person. I'm going to transfer ownership of this webinar to her now. Let's hope that works, and then she will begin. So I am going to do that right now. And Leila, you're the host.
Hello. I'm so happy to be here today and talking to you about boosting the immune system. Now, can everybody see me? Yes, I hope so. I want to just give you a little disclaimer. I'm not recommending specific therapies for COVID-19. There are no therapies yet that have been found that work 100%. I am going to review some common sense and very well researched advice on boosting the immune system for viral infections in general. And, you know, if these things work for other viral infections, they may just help with COVID-19 as well, but we don't know. So Okay, so coronavirus, everybody knows about it. We know the things that are recommended, which is social distancing, social isolation, not sneezing on other people, coughing on other people, and washing our hands really well. We have to remember where this came from. This came from eating wild animals, you know, so we have to be careful not to do that. And I'm really glad that the wild animal markets in China have been banned now because of this. So what I'd like to talk about today is what can we do to improve our chances of not getting very sick. Now, we know that most people who get corona and who are under 80 don't get very sick, or under 70. Children, I'm a pediatrician, and children in general get either no symptoms or mild symptoms. So that's a huge relief. But of course, for the people who are older, we want to do whatever we can, first of all, not to expose them by not seeing them or touching them or sneezing on them, but also what can we advise for them and for ourselves to boost our immune system. So I'm going to go through some lifestyle research, and I've put all the references on the slide so that if you feel like reading up a bit more, I've looked for really the kind of the best review papers on each topic so that you can just read one paper rather than searching for hours for the good ones. So lifestyle, I like the 3S, sleep, stress, and sugar, but of course it gets broadened out a bit. And then I would like to talk a little bit about pollution, especially given that in Australia, we have all been exposed to huge amounts of smoke from fires in the last few months, and which may not be such a good thing in this epidemic. Then I'm going to talk about a few nutrients that can be helpful and have been researched, very well researched for infections and immune system. And then some specific anti-inflammatory agents that reduce inflammation. Now, I cannot recommend them for COVID-19 specifically because they haven't really been researched for it, but there is research going on about them. And I'll talk a little bit about the mechanisms, how they work. I mean, we know that COVID-19, the people who get very sick with it, they get sick because they have this cytokine storm, this huge inflammation. So it makes sense to think about how we can calm down the immune system and that inflammation to help people not go through that. And then I will briefly review a few herbal remedies just to tell you what the research is that's going on out there without, again, recommending them specifically. So the 3S, I talk to all my patients about that. So number one, sleep. Sleep is so incredibly important. And, you know, my patients always talk about it for their brain to function well and for them to feel well. But in this case, of course, it's about immunity. And we have this beautiful study here that showed that, you know, the less you sleep, the more likely you are to get the common cold, which is a virus, not the same virus as corona, but also affecting the immune system in a similar way. So you can see, you know, if you sleep more than 7 hours, which is the recommendation. So usually for adults, we said 7 to 9 hours. If you sleep more than 7, you only have like a 17.2% chance of getting the cold. Whereas if you sleep less than 5 hours, you have a 45% chance. So a huge increase. So number one thing I would say is sleep, you know, and of course, for children, you know, the recommendations are get an Epsom salt bath, some magnesium to help you sleep. Maybe some chamomile tea can be helpful, a calming bedtime routine, some of the apps that help with mindfulness to help get you sleepy, like the Smiling Mind app, and all those things work for adults as well. So I think it's a good idea to get into a really good calming sleep routine. And also the recommendation is not to change your bedtime very much, but to stay, you know, get the same kind of routine circadian rhythm going. And if all else fails, a little bit of melatonin can really help you get to sleep and sleep well. So next thing is sugar. And that, of course, stands for more than sugar. It stands for nutrition as well. And we do know that most patients with severe corona disease have pre-existing conditions. And in particular, of course, hypertension. Tim, you talked about that last week, about the ACE2 receptors being increased, and especially in people who take the ACE inhibiting drugs, and that putting them at increased risk. But also metabolic syndrome, yeah? So either diabetes or pre-diabetes really increases the risk of severe corona disease. Of course, also chronic respiratory disease, so all the people out there with asthma or chronic obstructive pulmonary disease are increased risk. So we know that sugar affects the immune system. If you eat sugar, your cellular immune function is suppressed for several hours after that. And of course, most people don't eat sugar once a week and then have a few hours of suppression, but they eat sugar all day long. So I am very much against sugar and would recommend for everyone to cut that out and make, you know, sugar like a once a week treat, like they have done in the Northern European countries like a generation ago. They introduced Saturday Lolly Day, and all the children in Sweden and Norway and Denmark, they get a lolly or an ice cream once a week, and that's it for the week. And they have actually gotten rid of cavities, of tooth decay by doing this. And the children are happy. You know, I did that with my own kids when they were young. And if on Monday they said, oh, can I have a lolly? I said, oh, it's just a few more days till Saturday. And then you get it. And they were actually okay with that. I was always surprised, but they got used to it very quickly. So I think that's a good thing for us as well. You know, I love chocolate, so I have to stick to my own rules. Now, sugar is one of the bad things that we eat too much of in our standard Australian or standard American diet, the SAD diet. But of course, we also don't eat enough vegetables. We don't eat enough fruit. We eat a highly processed diet. And all of that is pro-inflammatory. So one of the first things I recommend for absolutely everyone who wants to improve their health is to start eating more vegetables. Rather than right away taking things out, is putting vegetables in. Only about 5% of Australians eat the 5 servings of vegetables that are recommended per day. And a serving is what fits in your little scooped hand. So a little 5-year-old serving is smaller than an adult's, but they should all have at least 5 scoops a day. And if you do that, you reduce inflammation in your body, and of course you improve your gut flora as well, which we will talk about later, improves your immune system again. So we know that a whole grain rich diet reduces systemic low-grade inflammation. Yeah, that's what we want. We want less systemic inflammation so that when we get a virus, we are starting out at a much better baseline. If we're already highly inflamed, the immune system is already on fire, and then it just bursts up much faster. It's also important to think of weight. One reason is that if we're all in lockdown now, it's easy to put on weight. So it's really important to exercise every day as much as possible, not sit on the couch all day, but also not to overeat. The temptation is big. I work from home now, and my fridge is only 10 feet away, and I could go every hour and open it. Really, really important not to do that, because, well, it's not healthy, one thing, but also with Corona specifically, we know that the people who get very, very sick are more likely to be overweight. So really important not to get there. There is many different ways that, people who are obese become more inflamed. And one of the ways is through the gut flora, and then also in the liver through lipogenesis, increasing inflammation and oxidative stress. So lots of different ways, but it's really important to keep that in mind and stay active and eat healthy. And watch that sugar film. That's my do list for every family who is in lockdown, because it's such an entertaining movie for families to see about how bad sugar is for us and how it's hidden in so many foods that we think are healthy. So one thing to do if you get bored. So what is actually a healthy diet? A healthy diet is an anti-inflammatory diet. And that consists of at least 5 servings of vegetables. You want your 2 servings of fruit. And a lot of my patients, a lot of the children do the opposite. They eat actually 5 servings of fruits and only 2 vegetables, which is not as healthy as the other way around, because fruit, of course, is healthy, but contains more sugar. It's healthy sugar, but still we want more vegetables. Then we want some legumes. They're really good for the gut flora. Some nuts and seeds, also good for gut flora, but also for magnesium, really great, which is calming, helps you in these stressful times. And drinking water, none of this fizzy drinks and juices. We really want to drink water, unless the juice is freshly squeezed, that's okay. But otherwise, stick to water. You can add some lemon to it. So the next S after sugar, which really stands for nutrition, is stress. So how we know that stress affects the immune system in many different ways. And I have given you 2 good review papers there that you can read up on if you want to look at the exact ways of how it affects the immune system. But the most important thing really to remember is that we need to work ourselves from stress into resilience. Yeah, if we can do mindfulness, walking, we're still allowed to go outside for exercise. And we know that a walk in the park, somewhere in a green environment is incredibly calming for our brain, but also for our immune system. And this is a great opportunity. I always think, what good could come out of this epidemic, right? And maybe one thing is a lot of people are starting now to do some kind of relaxation exercise, some kind of mindfulness. There are lots of apps out there to use, or even some meditation. I don't really care what people do, but if they find something that calms down their brain, it will also calm down their immune system. And actually, in the long run, everybody will be happier if they start doing that. So really important. And along with resilience comes also exercise. Yeah, it is paramount to exercise for at least 45 minutes a day. And, people sometimes worry if you exercise too much, will your immune system be affected? But actually there's some good studies out there and reviews of it that show that, people who exercise a lot are actually healthier than people who exercise a little. So if you want to go out for 2 hours a day and exercise, that's fine. Yeah, but at least 45 minutes a day. For my young patients, who are stuck at home homeschooling now or doing school online, I say, when you've done your 45-minute lesson, just go and run around the block for 10 minutes. It's just so good for you to just get off your chair and move and get some blood moving around your body. So the very, very important to put that into your routine, make a little schedule with your family or tell your patients to do that of, where you have kind of your hourly, especially for the kids who are used to structure. It's really important to have that on the fridge or wherever they want it. Just what is happening when and where's the exercise. Very important to have that in there throughout the day. And, if and maybe one longer session where you really do a workout. Now, what about pollution? Yeah, pollution affects our immune system very clearly. And pollution, of course, also affects our lungs. And as I said, we've had, months of fires in Australia. Even if you wore your mask, you still have breathed in a lot of PM 2.5 particles in that time. So, and that will increase your airway reactivity and even and airway dysfunction and asthma, but also with rhinoviruses. And, since the coronavirus affects the lungs, I would be surprised if pollution wasn't a bad thing for that as well. So what can we do about that? So, one thing is to, I think our actually outside air is getting better right now. We have no more airplanes flying, much fewer cars going. So there's probably less smog all around the world right now. So the outside air is probably better. But we know from research that kids especially, but even adults, are actually getting more pollution often inside their homes. So open the doors, open the windows as much as you can, to get some ventilation. And if there is a lot of dust and things, get maybe a HEPA filter in. I think every Australian household has one right now because of the fires. And also look for mold. Yeah, so mold, if you see it in your house, obviously it's really bad, but you may still have mold in your home that you can't see, but that you are breathing in. So really, really important, because that of course affects your lungs. It causes inflammation in the lungs, which then makes you more susceptible to getting infections. So I know that the mold remediators are actually very busy right now because people are aware of that and trying to get their houses as clean as possible for the winter. When, right now we don't have that many cases in Australia and New Zealand, and who knows why. Maybe because we all have pretty good vitamin D levels right now that are still protecting us, but we're going into fall and winter, and that's when, in general, viruses go up and our immunity goes down, and also mold goes up. So be aware of that as a really big risk factor for viral infections and respiratory infections. Now I want to talk about some micronutrients. So there's obviously not just vitamin C, D, and zinc, but I would say those are really the very most important ones. But here you have a nice little overview of all the things you may need. So, if your patients or you are not on a fantastic diet, it may be helpful to just take a good multivitamin just to cover the bases. But in particular, I worry about zinc because in Australia and New Zealand, our soils are very low in zinc. And I test almost all my patients' zinc levels because, especially those who have recurrent infections, and especially if they have those white spots on their fingernails. And they are often zinc deficient, or at least very, very low in zinc. And improve once they take zinc supplements, because zinc, is just very, very important for the immune system, for the cellular immune system. So, and the both parts of the immune system. It's also, we have some nice studies on, zinc inhibiting the H1N1 influenza virus. I know it's not COVID, but, it's a virus. And that zinc prevents pneumonia in children. So, and also in elderly patients, who we are, of course, most worried about right now. So I think living in a country that has depleted soils, very, very low zinc in the soils, and that it's hard to get enough zinc from the diet, it may be, especially if the patients have any kinds of signs or symptoms of zinc deficiency, prudent to give a zinc supplement or recommend one. Now, the symptoms of zinc deficiency are irritability, low frustration tolerance, slow wound healing. So I see a lot of kids who have like lots and lots of mosquito bites that just never heal. And, once they take zinc, the skin heals quite quickly. Or eczema that doesn't heal very well. So zinc is really important for that. And then also picky appetite. So just not being very interested in food because the taste buds don't work well if your zinc is low. And another symptom of zinc deficiency is slow brain processing and issues with focus and attention. So if you think about low frustration tolerance and not focusing, those would be really terrible things happening right now when everybody's in lockdown and working and studying from home. So zinc would probably solve quite a few issues. So very important to look at zinc. I usually get a plasma zinc level. If you can't get blood tests, then sometimes you can do a taste test if you want to. It's obviously not as reliable. But, giving a small amount of zinc would never hurt. If you take too much zinc, you'll feel nauseated. Yeah, and you can overdose with zinc. If you give it for a long time at high doses, your copper will actually drop because zinc and copper go like a seesaw. So what we usually see is people with low zinc have very high copper, and if you give zinc for a long time, the copper may drop. It's possible, and then people feel like anemic because you need copper to make hemoglobin, so they get very tired. So be aware of that. Now, apart from my favorite mineral, zinc, I'd like to talk about vitamin C. So vitamin C is a huge topic right now in the integrative medicine community and viral infections. And there are some studies going on right now to check whether vitamin C may reduce ventilation time in people who are on a ventilator, and it seems like it works. It clearly reduces the cytokine storm, which is, the big thing we need to do. So there are, at least theoretically, very good reasons to give vitamin C to prevent viral infections and someone who has COVID-19. But obviously we can't recommend it because there are no double-blind controlled, placebo-controlled studies yet, but they are coming. And I've given you the link to an article that goes through the research. And actually this is the link here of all the different clinical trials that are happening right now about intravenous vitamin C. If patients want to do something prophylactically, I think to take some liposomal vitamin C daily just to stay well through the winter is a good idea. It's certainly not going to harm. And if they get sick, I know that if I got sick, I probably would want some IV vitamin C. So, but, as I said, we can't recommend it officially yet. But, let's see what happens in the next couple months because there are several very interesting studies going on and several hospitals using this with what looks like really good success, but the numbers are still very small. So let's look out for that. Now, the other one of my top 3 supplements for immunity, of course, is vitamin D. And, vitamin D, we've had so many studies on vitamin D, and some say, yes, it works, some say it doesn't work. And what it comes down to is the dose really matters. If you give children tiny doses or adults tiny doses, it's not going to make a difference. But if you give the right dose, it does boost the immune system. Vitamin D has actual virucidal activity, so it kills the viruses, it stops them from attaching to the receptors. and it boosts immunity. So one kind of nice study that I chose here was where they looked at giving infants 400 IU, which is the general recommendation. That's the dose recommended for infants. And then they gave another group 1200 IU, which some pediatricians would say is too much, but they obviously tested them regularly and made sure they weren't overdosing them. And the ones who got the 1200 are the ones who didn't get the infection. So that was the difference. So you really have to give a good dose. And if you're worried about overdosing, just test, stop the supplement for a few days and do another blood test. If you can't get it, I know in New Zealand it's getting harder and harder to get blood tests for certain tests that we like to do, like vitamin D and zinc, but you can get a vitamin D home test kit and do it, at home for, I think, $25 or something like that. So I like to make sure that I'm not overdosing or underdosing my patients. So I do check regularly to make sure that I'm at the right level. So there is also a linear association of vitamin D and seasonal infections and lung function. So that shows you again, the higher the vitamin D, the better things are. So if you're, the lower your vitamin D, the more asthma exacerbations you get. And the more upper and lower respiratory tract infections. So I'm going to get to a good level. You can, of course, also overdose on vitamin D, but it is pretty hard. So you would have to take a very high dose for quite a while. And just remember that if you are out in the sunshine in the summer for a few hours, you easily make 20,000 units international units of vitamin D. Now, I'm not recommending that you give your patients 20,000 units a day, unless they're extremely deficient and you just do that for, a very short boost. But we make a lot of vitamin D in our body, but of course we have a negative feedback going on so that when our vitamin level is good, we stop making more vitamin D. But just remember, vitamin D in the winter is very important for immune function. And also, of course, for mood, that seasonal affective disorder that people get in the winter where they get sad and depressed is low vitamin D. In the Northern European countries, every child gets vitamin D in the winter. Actually, they get it throughout their first 2 years of life and then every winter. All my colleagues I know in Germany, where I'm from, take vitamin D in the winter. It's just totally mainstream. Everybody wants to stay well. There's not much sunshine there in the winter. Now, I wanted to quickly talk a little bit about another supplement that has been mentioned in conjunction with glutathione, with the COVID-19. So glutathione is, of course, the body's most important antioxidant and anti-inflammatory molecule. And there are some reports of doctors who have used it for patients with COVID-19 to reduce that cytokine storm, and it seemed to have had a good effect. The respiratory viruses cause changes in the redox homeostasis, so they cause more oxidative stress, which causes inflammation and tissue damage, and then cell death, which is bad. And then the reactive oxygen species that accumulate deplete glutathione, because you use your glutathione and other antioxidants in your body to turn those reactive oxygen species around to not be reactive anymore. So we need more antioxidants at that moment, and glutathione seems to be a very, very useful one. So, and in the end, the effect is that you're reducing the cytokine storm. Now, how can we get glutathione production up? Glutathione itself has a very short half-life. If you're in intensive care and incredibly unwell, maybe it's not a bad idea to get some IV glutathione. We don't know that yet. No studies yet, but we'll find out. But the glutathione taken orally has like a half-hour half-life. So it's out of your body very quickly. But there are other ways of increasing glutathione that are lasting longer. So one is N-acetylcysteine, which is the precursor to glutathione. And the nice thing about N-acetylcysteine is also that it breaks down mucus in the lungs. So it's used for patients with cystic fibrosis they get it as an inhaled nebulizer, and it breaks down the mucus and in the lungs, so it makes it easier to breathe. Another even more natural precursor is sulforaphane. And sulforaphane is very high in broccoli sprouts. So there is actually a really lovely professor who was at, I think, Yale University, who discovered sulforaphane as a potent antioxidant. And he retired from his university position and now makes sulforaphane broccoli sprout extracts. And a lot of my patients with autism are actually taking that because it helps them with the increased glutathione, really has a good effect on those children. So broccoli sprouts, I'm sprouting some myself right now. So if we're all running out of supplements because we can't get them shipped anymore, you can get some broccoli seeds and sprout them. So, and of course, you know, even eating broccoli, even eating any kind of sulfur vegetables like Brussels sprouts and so on also help you produce glutathione. It's just that N-acetylcysteine and sulforaphane are more concentrated. So if you need to get glutathione up quickly, that's the way to do it. So, and that, what does it do? It reduces inflammation on the whole body, but we are especially worried about the lungs right now. What else can we do to reduce inflammation? So what are the kind of supplements that I, or maybe some of you, use in patients in general to reduce inflammation? Now, one of my favorite ones is quercetin. You know, it reduces cellular damage. It's great as an antihistamine as well, so for people with a lot of allergies. And they use this AI to model the effect of various molecules on the coronavirus, and they found that quercetin, it's all computer research, but still, it suggested that it interferes with coronavirus binding to the ACE2 receptors. So maybe a good idea. Now, your natural way to get quercetin is from vegetables, from apples and onions and lots of different healthy foods. You can, of course, also get it as a pill. If that may be a good idea, but you have to be aware that quercetin does down and upregulate certain enzymes, so it can increase the effect of non-steroidal anti-inflammatory drugs, NSAIDs, because it inhibits the enzyme that breaks those down. So if someone is on one of those medications, then maybe watch out, don't give too much quercetin, or adjust the dose of the other medication. It also increases another enzyme, and that reduces the activity of some medications like midazolam. There's also a worry that quercetin can be reducing the conversion of T4 to T3 thyroid hormone. So if somebody is hypothyroid, it's not recommended, and we are careful in breastfeeding and pregnant moms because we certainly don't want them to be low in thyroid hormone, because the thyroid hormone is incredibly important for the brain development of the baby. So if you just watch out for those caveats and use quercetin safely, I think it's a great anti-inflammatory, and possibly, you know, may reduce the virus binding and also reduce the cytokine storm. So there is a lovely researcher in Canada, Michel Chrétien, who is actually doing a placebo-controlled study on exactly that right now. He got $1 million donated to test whether quercetin is effective in reducing mortality in coronavirus, COVID-19. So it'll be really interesting to see what comes out of that. Now, of course, with any of those studies, you probably have to wait, I don't know how many months, maybe 8 or a year even to get the final results, but I'm hoping that they'll update us on what they find sooner than that. Another hard to pronounce anti-inflammatory, palmitoyl ethanolamide, I like to call it P, is becoming very popular as a to reduce pain in chronic pain patients. But there was actually research done on PEA a long time ago, which showed that it was effective as a prophylactic and as a treatment for influenza and other respiratory viruses. So those studies are quite old, and I'll give you the references, but I think it has very few side effects. It's very good safety profile. It is a cannabimimetic bioactive lipid. So it also has the added benefit of calming people in these stressful times. And one of the major pathways that it works for the immune system is inhibition of the NF-kappa beta signaling pathway and mast cell degranulation. So we're reducing the production and release of the inflammatory mediators in the cytokine storm once again. So I like PEA, and here's some of the research studies, just in case you want to read up on that in more detail. Now, how could I talk about health without mentioning the microbiome, my favorite topic, and I think everybody's favorite topic at the moment. So we do know that probiotics affect the immune system. Most of our immune system sits in the gut. And, whatever we eat feeds the gut flora. If we eat healthy food, we have a healthy gut flora. If we eat sugar and a super high processed diet, we don't. So there are lots and lots of studies out there about probiotics, and I've just given you a couple just for your nice weekend reading. So probiotics, once again, they modulate the pro and anti-inflammatory responses in the body. The bacteria that are growing in the gut produce chemicals, so it's called the metabolome. So everything that's produced by them, by these microbiota, affects us in many, many different ways. We all know about the gut-brain axis, but there's of course also the gut-immune axis. In Lactobacillus rhamnosus GG in particular induces TNF-alpha activities, which increases IL-10, which is kind of the master regulatory interleukin to reduce inflammation. Yeah, so we want to have more IL-10 when there's a lot of inflammation, and that can also regulate the innate and adaptive responses of the immune system. So I think, the best way of getting a good gut flora, again, is eating an anti-inflammatory diet with lots and lots of vegetables and lots of different varieties. We know that hunter-gatherers ate I think 60 different vegetables a week or something, or even more. And we now, in general, my patients at least eat 3. They eat broccoli and carrots and maybe some cucumbers. So we really need to broaden that to get a better gut flora. We know that a really good predictor of a good gut flora is how diverse it is. The more diversity in the gut flora, the healthier we are, the calmer our immune system is. And we get that diversity by eating a diverse diet. Now, I just want to quickly talk about a few herbs. Now, I'm certainly not an expert on herbs, and I'm especially not an expert on herbs for COVID, but there is a lot of research going on, and I'm giving you here one article that has been quite popular in the integrative health world, and they are going through lots and lots of different Chinese herbs, and I just want to highlight astragalus, which seems to be quite effective, and it's of course something we can get here as well in various supplements. There's also licorice has been shown to have some effects against COVID-19. You have to be careful with licorice. It increases blood pressure because it goes to those ACE2 receptors. So people with high blood pressure should not have licorice. And then rhubarb seems to be also one of the herbs that has an effect, a positive effect. Then there are various mushroom extracts, I think, we are going to see some studies coming out. We don't have them yet, but, if you are familiar with the supplements that are available out there for immune boosting, a lot of them now, mushrooms are actually quite trendy. And there are some mushroom extracts with astragalus added in. So I think that would be probably a good combination just to boost your immune system, reduce your risk of getting sick, and also reducing the cytokine storm risk. I wanted to quickly mention elderberry because I've had a lot of questions about elderberry. Elderberry is a very popular supplement to boost immunity in the winter. A lot of people take it. You see it on every shelf in the pharmacy. And there was some concern whether elderberry, because it boosts the immune system, whether it would be a cytokine storm. And I don't think that is true, but I don't know. But there is certainly indications that elderberry is not just immune boosting, but also anti-inflammatory. And there isn't any evidence that elderberry makes a cytokine storm worse. Yeah, I don't know where that came from, but there isn't any evidence. There are no cases that are reported on that. And there is some evidence that with acute respiratory distress syndrome, you actually reduce the inflammation with elderberry. Now, just like you may have heard that there was this controversy about ibuprofen as well. Would we take ibuprofen or does it make people worse with COVID-19? And for a while, people were saying not to take it, and now WHO has actually taken that back and has said it's okay to take ibuprofen or Nurofen. I mean, with those medications, I wouldn't take it unless it's necessary, but it's probably if a patient is taking it and it has been prescribed, it's not going to. It doesn't look like it is going to harm them. So elderberry is safe. Looks like it. So I just want to go review what I talked about, which I hope gave you a little bit of an overview of what we can do in these very stressful times where we're all locked in at home and not getting out very much. What can we do to actually keep calm and keep our immune systems calm? And I think one thing that I maybe didn't mention of the stress of being lonely. There's so many people out there who are either on their own, including my son in Berlin, who's in a little apartment all by himself. And then lots of people who are maybe, not totally alone, but just, an elderly couple who usually sees their grandchildren or their children or their friends and now can't. And that definitely increases inflammation in the body, loneliness, because it reduces your oxytocin levels. So, finding ways of increasing oxytocin, maybe a warm bath or listening to your favorite music or meditation once again, mindfulness. I mean, there's so many different ways. You can adopt a pet if you don't have one. All the SPCAs are looking now for people to foster pets. So since you are stuck at home and not going to travel, maybe that's a good idea. And maybe even having a Skype dinner with someone to use it, you see them on this computer screen, but you're not completely on your own. So I think those things really, really important to keep the connections up and help the people who are on their own and the most vulnerable. And I really loved what Jacinda Ardern said when she said, we have to meet this epidemic with kindness. I think that's hopefully what will come out of it at the end, that we will all be kinder. So get enough sleep, get rid of stress, increase your resilience by doing some mindfulness and any other way you find of calming down, because it will be good for your immune system. Eat a whole foods diet, breathe clean air, maybe get that HEPA air filter into your house, or at least ventilate really well and get rid of mold. And then, make sure that you and your patients are getting the nutrients they need, that they're not vitamin D deficient, they're not zinc deficient, they're not vitamin C deficient. Vitamin C deficiency is actually increasing, especially amongst smokers. Smokers are very often vitamin C deficient, and we always thought, that's something that sailors got 200 years ago, vitamin C deficiency, but it's not true. We're still getting it now. And then, consider if someone gets sick, some anti-inflammatory supplements that may reduce the risk of getting that cytokine storm. We'll all look out for the studies to see which ones pan out to be the most effective. But be aware, I think we as a community, we're very interested in, new ways of treating and maybe using old things that we know that have worked for other diseases, and maybe using treatments that are not the most expensive, and therefore maybe not the sexiest. But I think this epidemic is going to teach the whole community, everyone in medicine, to look out for what is most effective and readily available. So I hope so, at least. So thank you very much for listening. I'm